Hi, everyone. I'm Amy Zelmer from Faces of TBI, and welcome to the Brain Health Online Summit Training Series. I myself am a survivor of a TBI from a fall on the ice in February of 2014. And myself, along with Dr. Jeremy Schmo at Minnesota Functional Neurology, we saw a need in the brain injury community for more training and education on different alternative healthcare methods and modalities for those who are still struggling with the lingering effects after a brain injury. So our goal is to help educate and bring awareness to this invisible injury that affects 2.8 million Americans each year and is the leading cause of death and disability in the world. Each day, we're going to be bringing you 4 to 5 different speakers who will share their experience either dealing with brain injury patients or their real-life experience of living with a brain injury. So today I'm here with Dr. Jill Schultz. Jill is a Minnesota native. After her undergraduate degree at the UMD, she received her Doctor of Optometry at Pacific University College of Optometry. Dr. Schultz then completed a residency in pediatric optometry and vision therapy at Southern California College of Optometry. She is currently in private practice in Otsego and Minnetonka, where she specializes in pediatric vision care, vision therapy, and vision problems related to learning difficulties, developmental delays, and acquired brain injury. Dr. Schultz is a fellow of the American Academy of Optometry, College of Optometrists for Vision Development, and Neuro-Optometric Rehabilitation Association. She is a residency coordinator and associate clinical professor associated with the Pacific University. Dr. Schultz is the clinical director of the Special Olympics Minnesota Opening Eyes program, state coordinator for the COVD, and mother of 3 wild but adorable children. So welcome to the summit, Jill. We're so glad to have you here.
Thank you. Thank you for having me. This is really a pleasure and I think such a great thing to do. There's such a need for support and information, so this is very cool.
Yeah, and we're really happy to have you here and just talking about, how our eyes are so related to our recovery after a brain injury.
Yes, definitely. A lot of patients I see come in and they're kind of confused about why they're even in my office. And most of us think of vision as eyesight, glasses, 20/20, but actually your eyes are controlled by your brain. So when there's an injury, a lot of things can happen that make everyday life pretty challenging.
Mm-hmm.
So it's good. I'm glad to be here.
Yeah. So, you just kind of brought up a point. A lot of people think of your eyes simply as your vision and whether or not you need glasses. And for someone like myself, my vision was still 20/20. With my contacts, it was still 20/20. And like my actual vision hadn't changed, but like I knew something wasn't quite right with my eyes. And so maybe you can start out kind of talking about that component.
Okay, definitely. And this is when I first see a patient, this is kind of what we talk about because it is very confusing. Most people don't realize of that connection between vision and all the symptoms that can happen. But if we talk about how vision actually develops, it makes a little more sense. So it all kind of starts out during development. Our visual system is actually a brain skill. Um, Visual acuity, which is the 20/20 portion of sight, that's called visual acuity, is the sight, is very important, but it's not everything related to vision. Our vision really develops and is a learned thing. So, for example, during infancy, vision is developing. A person is integrating, and if you want to use an analogy of computers, it's like writing code. So we're writing the code for future development by integrating vision, vestibular information, motor skills. All of that is writing the code for what we need for everyday life skills and efficient function. If an injury occurs down the road, that code is kind of lost And I know many of us know that, let's say, an MRI or a CT scan isn't going to determine if you had a concussion or not.
Right.
It's all about the connections. So that's really what happens, is those connections, integrating vision, vestibular, all of that information, that spatial map in your brain, visually speaking, can get messed up. So
Mm-hmm.
that's what we work on.
How common is it to see visual problems after a brain injury? I've heard as high as like 90% of people will have some visual problems.
It really depends on the study you're looking at, but the studies really show anywhere from 70 to 90% of patients with a brain injury have vision issues. And when I see vision issues, sometimes it's visual acuity, sight, but oftentimes it can be light sensitivity, difficulties with how their eyes are working together as a team. Tracking issues are probably the number one um, issue that we're seeing, and that improves function. So, I mean, pretty much, if chances are, if you have a brain injury, you're going to have vision problems.
And so what do you typically see in your clinic? What are some of the bigger problems that you see, and what do you do to help that?
Yes, that's the cool part about my job and vision, is that we do see vision problems quite a bit. Most things that we detect during a special eye exam that we do are treatable or fixable to some extent. So it's good. It's
Mm-hmm.
a good thing when I find things during the exam, because it means I can do something about them the
Right.
next time. So the biggest thing we want to start with are the basics. Are your eyes healthy? Sometimes when you fall or have an injury, or some event, there can be an eye health issue. So we want to make sure that's addressed right away. And is it something that's getting worse over time? So we address that. Um, a lot of my patients, though, have difficulty seeing, and visual acuity and sight isn't everything, but if you're struggling to see your computer or read
Yeah.
letters on the page, that's going to make your function a lot more challenging. So we address those basic issues. Another common difficulty we see are tracking issues. Tracking issues are how your eyes are coordinating, and that's important for driving, for reading,
Mhm.
computer, for sports. And if those skills are not intact, you can have dizziness, motion sickness issues, difficulties with reading fluency, completing work in a timely, efficient manner. Um, that's the big one. One of the number one problems that we see is something called convergence insufficiency, and there's been a lot of research about this condition, and it's a fancy way of saying that your eyes are deficient at converging. So, for example, a lot of doctors now are doing testing of converging, watching your eyes move in, and we know that's a big marker for concussion. And sideline screening is now incorporating some of these visual skills. But all of these things waste your energy, and they make
Yes.
everyday life more work. So people are more tired at the end of the day. They might cause headaches, or make headaches, more problematic or more severe, frequent. So if we eliminate some of these vision problems, life in general is going to be better. Recovery is going to be faster, um, and overall, it's hopeful. So yeah, good stuff.
Yeah. So, I kind of had a compilation of all those problems. I remember the convergence. Like if I was looking at my phone and then I'd look up at something further away, it would be like, or
Yeah.
vice versa. And then like I couldn't read my phone. And my eye doctor. So I do want you to address like what type of eye doctor to look for.
Okay.
Because I had gone to my eye doctor that I've seen for 10 years, and she truly believed me that something wasn't right. She tried so many tests. She tried some prisms with me. Nothing was helping me. And she couldn't figure out, what the problem was, because it's just not, she wasn't trained in that capacity. And she gave me reading glasses to help with that convergence, which they did help. They took some stress off of computer work and reading a book, but they didn't fix the problem, right? So I take the readers off, and then it was like, oh, like I had to get used to the world again. So I guess, what can someone look for? Like, someone like me who goes to the regular eye doctor, they're like, your eyes seem fine.
Right.
Who do you need to seek out that could help you?
That's a good question. And yes, we do see patients who have had, typical eye exams. And I think that's the great thing about what you're doing here is bringing awareness to patients, but also
Yeah.
to care providers to kind of, continue that education. And concussions are so common, and there are people in all all over that we come in contact with that are affected by a brain injury in one way or another. So my best advice, there's an organization called NORA, and it's Neuro Optometric Rehabilitation Association, and they have a website called nora.cc.
So
And
NORA.CC,
that's correct.
like
And
cat.
I don't know where the CC comes from, but that is the website. And that is an organization that of eye doctors. It's a multidisciplinary organization. So there will be physical therapists and occupational
Mhm.
therapists, functional chiropractors that are members, but it's primarily an optometric organization. Um, that you are going to find someone in your area that specializes in this specialty area. And there are certain things that um, patients that have a brain injury um, that are very important, their vision and prescribing. So, for example, their systems are very sensitive. So they are going to have different challenges than someone who isn't suffering from a concussion.
Mhm.
So things like not making glasses too strong, or there's certain materials of glasses that will exacerbate symptoms. Um, so it's a little different, but we all have training in that area. So that would be my best bet. Another organization, if that isn't available in your area, is an organization called COVD, and that website is covd.org. And that's another great resource. That's more geared towards pediatric vision care and vision therapy, but that's another good reference for sure.
Mhm. So what do you do to help your patient? So someone has convergent problems or tracking problems. What is it that you guys do differently that you're able to help your patients?
Yes. So I'm into doing easy things first. When you have
Mhm.
a brain injury, you are struggling to get through the day, take care of your family, take care of yourself, going back to work. All of that is tricky. And many patients have other appointments that they're going to and,
Mhm.
caring for themselves. Um, so extra therapies, I'm going to try easy things first that are going to give the most bang for your buck in terms of time and energy. So the number one thing we can do is offer glasses. And they're not glasses to make you see better necessarily. They're glasses to make your brain work better. And that sounds
Mhm.
very weird, but it does work in a lot of cases. We employ different strategies with Prism. Prism is something that can be very powerful, and it needs to be used in a specific way. But Prism can be really helpful. I've had patients where they have struggling with balance and walking, and they wear Prism lenses and they can function. They can go grocery shopping. They can get through the workday, and it can be really helpful for some patients. And I think brain injury management requires a team approach.
Yeah.
I think vision's pretty important, but I'm fairly biased. But 80% of what we interpret from the world comes through our vision. So it's a great tool to leverage rehabilitation. The glasses is my number one go-to because it's a quick fix and it's easier than other things. Once we can maximize that, we think about filters, lenses that are colored filters that can be really helpful, especially for light sensitivity, because that's a big problem. Sometimes
Mhm.
light filters over computer screens or things like that. A lot of patients with brain injuries have issues with sleep. And blue light that's emitted through computer screens and technology can really make things worse. So there are some solutions for that. Um, and then finally, well, and then communicating all of the findings and the diagnoses to a care team. So physical therapists, occupational therapists, chiropractic care, functional neurologists, and psychologists. I mean, sports medicine, every physiatrist,
Right.
every and the patient, educating the patient on this is why you're having these symptoms. You're not making it up. This
Yeah.
is normal. This is why things are difficult, and how you can explain it to your family or your friends or your coworkers of what you're going through and why. I think that's powerful to know what's going on and know your own situation.
Mhm.
After that, vision therapy is another approach. We call it vision rehabilitation, and there are specific exercises that can be used to improve those skills. Convergence insufficiency, for example, that convergence condition responds really, really well to vision therapy. It is one of the most studied conditions, and we have a very high success rate if that's the diagnosis. And we also work on other, vision is such a dominant sense, so we incorporate vision with balance and auditory and motor skills to really make sure those skills translate into the real world. So that's pretty much it, I think.
Yeah, like people, we just take our vision so for granted. And, I was really struggling. Like I said, my vision was okay. Like I could see things, like that wasn't the problem, but I just knew something wasn't okay with my left eye. And my optometrist, she tried so hard, and then she sent me to the neuro ophthalmologist to make sure nothing's damaged. Have you damaged a retina or something? And that came back fine. And I mean, it took me 2.5 years to find Jeremy, who was the one who finally was like, "It's your eyes." So I think it's important for patients to understand, keep searching, keep looking for that doctor. And you gave the two sites, the nora.cc, and then what was the other one? COVD.
covd.org.
.org. To look for someone who specializes in this, because there are people who can help you. And you talked earlier about how it takes so much energy. And I know once we cleared up that dizzy imbalance, like I constantly felt like I was kind of like floating. And when I'd lay down at night, my eyes would kind of spin around in my head. And when we got that under control, my energy levels just, I mean, I wouldn't say they soared, but I mean, they did. They soared because I had so much more energy to do other things.
Yes. Yeah. Yeah. And like you said, um, asking if you feel like you're not getting answers and your symptoms are not resolving and you've been doing all the right things, that's when it's time to check out other options and get a second opinion. Because the information base is growing at such a rapid pace that it's very challenging to keep up with. And many care providers are doing their best. They have the best intentions, but unless they are seeing these, concussion patients and
Mhm.
on a regular basis and keeping up with the literature, they may not have the latest and greatest information that can help you. And
Right.
it's good to keep your eyes and ears open for new stuff.
Literally. Yeah, I remember. So I was a total bookworm. I would read probably a book every week or every 2 weeks. Or sometimes I could read a book in a whole like weekend. Um, and when I first fell, reading was so hard for two reasons. First of all, just the act of reading was really hard. It literally hurt to read. Plus, I would read a chapter and then the next day I'd forget what I read. So there was that challenge too. But I just remember how hard it was to read. And at one of my assessments, they asked me to read out loud from this page. And I was moving my head as I read.
Yeah.
And you're like, okay, now do that again, but this time hold your head still. And I was like, what? I didn't know I was moving my head. And so that was an indication that my eyes didn't want to work together. So it was easier for me to move my whole head.
Yes, and that's very inefficient. And a lot of symptoms or signs of concussion or brain injury are very similar to what we see with children that have some developmental vision problems. They're kind of the same. And my background started out in pediatrics, and I feel it's been very helpful for understanding how the visual system develops and what can happen. Because vision problems are pretty common in the general population, and we definitely see patients who have pre-existing vision issues, then they have an injury and they're probably magnified. That wasn't the case for you, but it's very common to strain, figure out all of that, and
Mhm.
what we can best do to help the patient.
Yeah. And I think, like Jeremy kind of explained to me how when I hit my head, you kind of rattled that hard drive a little bit. Kind of like talking about your coding.
Yeah, yeah.
And, we just seeing is such an automatic thing. We don't think about seeing. So so what was happening is my left eye was wanting to go out. It didn't want to work with my right eye. And so when that's happening, you don't know what's happening. And to train it to go back was so simple. It was really was simple exercises. And once we got it back under control, it was like, wow, that was so easy. But we don't know what we don't know, that our eye isn't working right.
Right.
So I think that's a big challenge in communicating with our doctors, especially if you're going to a medical doctor who truly doesn't know much about the eyes to begin with, and they don't know how to help you. Do you
Right.
kind of see that?
Yes, yes, definitely. And I think that's starting to change. Um, there is more awareness, and they're catching on. There's a huge amount of research pointing to the visual area of as a deficit, as a marker for concussion detection
Mm-hmm.
for treatment. So research
Yes.
will show, and I think, you know, that makes everyone a better provider and patients to have access to better care. But in the meantime, we really have to educate them. And it's kind of ironic, isn't it, that, these vision problems are invisible,
Right.
but play a huge role in your recovery.
A huge
Yes.
role. It's like you
Yes.
said, if your eyes aren't working right, you've got balance and dizzy and headaches and light sensitivity. Um,
Right. Yes.
um, do you do anything with tinted lenses?
Tinted lenses? Yes, yes, that is definitely an option too. Specific types of filters or tinted lenses can really help, particularly light sensitivity symptoms. Obviously sunglasses. And I would say one tip, many patients, when they have light sensitivity, they gravitate towards like a black, really dark tint. Um,
Right.
my experience, I am finding that patients do better with a brown tint. Um, and I guess that's counterintuitive because it looks less dark, but I feel
Right.
like that wavelength of light is more helpful. Um, and you reminded me of another treatment option. It's called syntonics or light therapy. that can be really
Mm-hmm.
helpful for patients with, headaches, eye strain, because what we know is after a brain injury, your peripheral vision and your central vision don't work very well together. So patients have, they're bothered by patterns or weird hotel carpeting, grocery stores, the aisles are fluorescent lights,
Mm-hmm.
scrolling on computers, those all can be related to the hypersensitive visual system or peripheral vision. And Syntonics is a way to cool that down, as well as the other treatments like vision therapy and the prism glasses. So
Mm-hmm.
lots of new things, new cutting edge type treatments that can be helpful.
And you brought up the computer screens and fluorescent lighting, and I know that's a big complaint I hear from people is like it's hard for me to be on a screen, whether it's their phone or the laptop, but they have a lot of screen problem and overhead fluorescent lighting. Are there any? I mean, aside from just not using it, are there any suggestions you have for that?
So yes, so definitely when the glasses, so the prism lenses should make the eyes work better when they work. And of course, it's not a magical cure, like one size fits all approach. I wish it was. Um, but I would say 80 to 90% of patients respond to the prism lenses and have an improvement in function and symptoms. Um, so oftentimes it makes a very significant difference on computer use. That small amount of prism and a nearsighted or a power of lens that can help them for up close. And it's like I said earlier, it's not a strong amount. It has to be very small usually, but that can cut down on that scrolling sickness feeling, and make things not so bright and make things more tolerable. And those are the things we test in the office to make sure that patients are responding to it before we prescribe it, because we want to make sure that the tools are going to be actually helpful before you dive into them.
Right, right. So, Jill, do you have any final words of wisdom for our viewers?
Oh my goodness. Well,
We kind of covered a
um,
lot, but
yes, I would say, if you are still struggling with symptoms, make sure you have a functional vision eye exam with a doctor who is trained in um, brain injury and can offer some solutions. And that nora.cc is probably the best bet of where to go for help so they understand those specific vision issues and how to treat them. And then keep looking for answers. I
Mhm.
encounter patients all the time who have kind of been on a lost path. And I think that's what you're trying to do here is shed some light on it and provide information and encouragement. So, because things do get better, there are treatments and um, there is a lot of hope to make things better. And that's not what a lot of patients are led to believe sometimes.
Yeah.
So just talking about it, building awareness is awesome, and having that support system. So many people struggle with brain injury, um, that we need to talk more about it and address it and get better treatment options available and
Mhm.
educate healthcare providers.
And I think another thing that just kind of struck me is just no matter how far out you are from your injury, there's still hope that someone like you can help treat that problem.
And I would say, when I was a kid, concussions weren't diagnosed the way
Mhm.
they are today. So I think most of us have had an injury. We just don't know it.
Absolutely.
when and I encounter that a lot just in regular eye care we provide when someone has all of these symptoms, and I ask, have you ever had a brain injury or concussion or a car accident? And they're like, well, yeah, but I've never been diagnosed. And then
Yeah.
you there are people all over walking around and suffering, and they aren't aware. So it's good that we're progressing.
Absolutely. And Dr. Schultz, you have a free offer for our listeners. You are offering a free neurovision screening. Do you want to just give a brief talk of what that is?
Yes, I'm really excited about this. So we have put together a neurovision screening, and it's an assortment of mini assessments that we do in the office all the time. But there is something called the right eye vision tracker, and what it does is it is a computer that measures your eye movements. So, in this batter, and then we also do the King DVIC, which is another eye movement test. They're using it now on sidelines
Mm-hmm.
of for athletic events to determine if a athlete has had a concussion. It's an easy, quick vision test to administer. And then we have a symptom checklist questionnaire, and then provide next steps. So all of these things are very cool. If you're not sure of where to proceed, we can do the screening. It's no cost. Um, and just call the office and ask for this assessment, and we can point you in the right direction. But it's also nice as a baseline.
Yeah.
Baseline testing is so important because we don't know what visual skills were like before sometimes when you had
Yeah.
an injury. So having that baseline is pretty cool, especially, it's talked about for kids and athletics,
Mhm.
but a lot of our patients aren't kids in athletics. um, so it's kind of a neat screening we're offering at both offices.
Excellent. And that's in Otsego and Minnetonka, correct?
Correct.
Yeah. Well, awesome. Thank you so much, Jill. This was really great information, and we really appreciate you being part of the summit.
Yes, I'm excited to be a part of it. Thank you very much.
And thank you, everyone, for watching. Remember that you are not alone in brain injury. And all of these recordings are available. If you're not able to catch them all live, they are available for purchase for $29. And a portion of those proceeds go directly to the Brain Injury Association of America. So thank you all for watching, and thank you, Jill. And we'll see you all again next time.